Good morning, everybody. This is Dr. Mayorga, and again, it's been a couple of weeks since I've done a video. I want to hope that all of you had a wonderful past weekend. If you celebrate Easter, happy Easter. If you just had a great weekend, well, you had a great weekend. Although the weather's kind of crazy, I'm what I call a frustrated meteorologist, and I follow the news, I follow the weather, and we had been out of town in Arkansas in Eureka Springs the week before the weather came, and we were in Fayetteville, and we were in Van Buren, and we were in Springdale. So a lot of those places that got hit by tornadoes, we enjoyed the really nice weather while we were there. So I always think about the people that experience violent weather like that, and hopefully that they're doing okay. But today, we're going to move over from frustrated meteorologist to counselor and counselor educator. And today, my topic is contemplating counseling. If you're contemplating going to therapy, what are some of the questions that you need to think about before you start the process? And I think about this because, of course, I see clients, and a lot of times clients will come once and then they won't come back for a couple of weeks. And when they come back after a couple of weeks, it's like starting all over again because in the time span between that first session and maybe 5 weeks later, lots of things have happened to them. And a lot of times they come back in a crisis. So, one of the things that I wanted to share with you is to think about questions that you need to contemplate as you make the decision to enter the journey of being in therapy. You're on your mental health journey. So, one of the first things that you need to think about is what type of therapist are you interested in going to? Because when you're looking for a therapist, it's very much like looking for a doctor. You need to think about if you're going to click, how do they work with clients? Because, doctors have a certain bedside manner. Having been in the nursing field, I ran across a lot of doctors that didn't have very good bedside manner and tended to lose their patients because they just did not know how to interact appropriately. They were professional and they knew what they were doing, but there's more to just being professional and know what you're doing. You have what in counseling is called the therapeutic relationship. So I tell people that are asking me, I need to look for a therapist. I always say to them, well, interview them. Make sure that you're going to click. Make sure that you feel comfortable. And it's not like you're going to feel comfortable right away, but you know when you're clicking with someone. And there are certain questions that you need to ask the therapist. How do they work with their clients? And a lot of people that are contemplating going to counseling, they don't know that they need to ask, what about the theoretical orientation? But it's a good thing to say, how do you work with your clients? What is your expectation of me as a client? And then here's what I expect from you as a counselor, so that then the counselor can give you an idea of what is going to happen in the process. Because a lot of times people have never been to therapy and they're not quite sure why the counselor does what they do, or ask certain questions, or take their time in doing an intake. Most people think, well, I'm going to go to therapy and they're going to tell me what to do and then I can leave and it's all going to be okay. But it's not like that at all. It's a little bit of a longer process, and it does involve you knowing uh, what to generally ask and get some feedback from the counselor. So when you call to set an appointment up, ask for a consultation, that you'd like to have a consultation with the counselor first before you make your first appointment, because that's generally what I do. Let me give you an appointment for a consultation. I'm going to talk to you about how I work with my clients and answer whatever questions you might have. And then at the end of that consultation, I generally ask my client, would you like an appointment to come see me? So that gives them an opportunity to think about it. They can call me back or they can leave and decide not to come back. But One of the things about counseling is taking ownership of your own mental health journey. And it begins by being able to meet with the counselor before you have your first session and check it out. It's appropriate to do that. And one of the things about looking for a counselor is generally people will know somebody that went to therapy and they'll ask, hey, what about your counselor? Or you go to maybe a site that has a whole list of counselors and they list a whole bunch of stuff and you're just not quite sure. Uh, and it helps if you have a consultation and give an idea of what you're looking for in the way of help during this consultation. And then you can go deeper when you have your first session. The second question you need to ask yourself is, how committed are you going to be? One of the things about therapy is you need to be committed for at least 3 months because counseling doesn't help right away. Unless you're going to someone for a consultation where you're going to talk to them and they're going to give you some ideas and poof, that's it. Generally, therapy, I say to my clients, give it 3 months. At the end of the first 3 weeks, we'll reevaluate. We'll evaluate to see if we're in the right direction, if you believe that you're seeing improvement, and if you want to keep going forward. But at least a 3 month commitment. It's not, I'm going to go now. And after this first session, or I'll give the client or the counselor 2 sessions, and that's it, I'll be through. Because generally, people don't go to therapy to do preventative work. And I think I've spoken to this before. Generally, it's already intervention work or it's a crisis. And so it's important to ask yourself, how much of a commitment am I willing to give therapy? Am I willing to give 3 months? If you're not willing to give 3 months, I'm not going to dissuade anybody from going to see a therapist, I should say. But 1 or 2 sessions generally is not going to be enough to get you on the road to a healthy mental status. The next question is, how deep do I want to go in therapy? One of the things that I talk about is most clients want to stay superficial, kind of bouncing up here. Think about it as water, and you're in a boat and you're bouncing around in the water and you're just kind of floating around. And at the end of a week or 2 weeks or 3 weeks, you're kind of in the same place because you're not committed to going any deeper. Of course, this also falls on the counselor of knowing what strategies and techniques to use to help you go deeper. And sometimes the clients get upset and angry and won't come back because the counselor is doing a good job of helping you gain those aha moments and uh, taking you to a deeper place. So that's the third question you really need to ask yourself. How deep am I willing to go in the process of counseling to explore, to be curious, to lift off those areas that have been in darkness or haven't touched in a long time? And then uh, once you make those decisions or ask yourself those kinds of questions, then proceed with calling up or looking around, or again, I'm going to say this, interview your therapist. I had somebody come to me and said, I had another therapist and I decided to not go back because on their profile, they said that they had 15 years of experience. But in their interaction with the therapist, turns out that the therapist had been married 15 years and had decided to go back to school and had just graduated from school, but was stating that there was 15 years of experience in her life. But so we have to be very careful when we read the description of a counselor. That's why we go and have a consultation and ask the right questions. Look at the walls, see what kind of licensure they have, because that's another thing. Depending on your issue, what kind of licensure are you looking for in your therapist? If this is a couples situation, you can go see a licensed professional counselor, or you can see a social worker, or you can see a marriage and family. It just depends. And each person or each counselor works differently based on their educational background and strategies and techniques and things like that. So, going to therapy is a little bit uncomfortable, so try to make this as comfortable as possible for yourself by making sure that you ask questions of the person that you're going to go see. Now remember, I'm a counselor and a counselor educator, and this is what I teach my counselors in training to encourage people that are wanting to come see them to ask these questions and be available for them. Because again, counseling is not comfortable. And most people won't even contemplate going to a therapist because they think, I'm going to expose myself and what are they going to do with the information? The majority of people don't really know about confidentiality and how that's a really tight thing that we protect as counselors, and they need to know why would be the reasons for us not to keep confidentiality. So there's a lot of things that clients need to know before they start therapy. And so ask if you're the person that you're considering going to offers a consultation pro bono. Doesn't really have to be a fee. If they want to charge you $50, I mean, it's well worth it to go ahead and do a consultation without filling out any papers. This is not a psychosocial that you're going to be doing. You can do that right before you go for your first appointment. You're just consulting with them to see if you and that person are a good fit. And like I said, you can go home, you can mull it over, look, go over the things that you talked about. How did you feel? Did you feel comfortable in the office? Did you feel comfortable with a counselor? Did they answer all your questions? Did they seem to know what they were talking about? I promote counseling, but I also promote competency in counseling. And so it's important for you as the client to think about that competency of the person that is sitting across from you that you're going to go and spend some time with. And again, commitment, at least 3 months to make sure that you see the improvement that you're seeking, that you can really work on the goals that you bring to therapy. And even if you don't have any goals, there will be goals that will be established when you're working with your client. So I'd like to thank you today for listening to my video. And if you are interested, please subscribe. I do this as a courtesy and because I'm so passionate about counseling. So I try to share information for the population so that they can understand what it is to be in therapy and how enlightening it is when you spend time exploring and being curious about your life and moving it in a positive direction. Thank you.